Thank you, Mr Deputy Speaker. And bulk billing rates are declining across Queensland and have been for a number of years, but no more greater than in regional Queensland and across the electorate that I represent. There are no fully bulk billed medical practices in the Greater Mackay region anymore. And this tax by stealth that's going to impact general practice is another example of this Treasurer's arrogance. No consultation, not listening to industry, little regard for Queenslanders, and especially Queenslanders that live in rural and regional Queensland. Mr Deputy Speaker, I heard the member for Ipswich outline comments made by the RACGP President, Dr Nicole Higgins. I'm proud to say Dr Nicole Higgins is my local constituent. Her practice actually is in the Whitsunday region, and I get to speak to Dr Nicole Higgins quite regularly and at times quite informally down at our local Bocasia Beachfront Cafe, Mr Deputy Speaker. And I will quote Dr Nicole Higgins that said, "It is another nail in the coffin for struggling general practices in Queensland. Practices with 2 or more full-time equivalent GPs will be affected. So it is particularly bad news for rural and remote communities, which are often served by small practices with only a few hard-working GPs." And no one knows more than the member for Burdekin, where parts of his community, where we've only had 1 or 2 GPs that have been crippled under this state Labor government, where we have communities that don't even have access to a GP anymore because of the failures of this Labor government. Mr Deputy Speaker, the Vice President and Queensland Chair, Dr Bruce Willett, went on to say that this tax will have a devastating impact on communities across Queensland. It will result in worsening health conditions, more strain on our already overburdened hospital system and emergency departments. And we know, as outlined by our Shadow Health Minister, that EDs are at capacity. Ambulance ramping at 44.7% is the worst in the country. And in Mackay, since 2015, when this government came to power, and the local members' time began in this House, we have seen elective surgery waitlists soared by 885 to 1,702 since 2015. That is a 108% increase. And then this government wants to inflict more pain and hardship on general practice, which is going to be a deterrent, Mr Deputy Speaker, for people accessing that primary health that we know they desperately need. Mr Deputy Speaker, I have had the pleasure to meet with many practice managers across my community of Mackay and the Whitsundays. I've hosted the Shadow Treasurer to meet with general practice managers across the community. And a lot of general practice managers are not doctors, Mr Deputy Speaker. In fact, I represent where they are single businesswomen who are running GP practices, Mr Deputy Speaker. And I'll refer to Kath, who I reached out to through my office this morning, who's a practice manager, who actually held a staff meeting this very day advising that patients are not going to be happy. It is going to cause enormous frustration because just in the last 12 months, the rising costs and the cost impost on business, when you add up electricity, goods and services, freight and transport, under this current government have increased over 20%. They are already under enormous pressure in the need to increase fees and charges, Mr Deputy Speaker, that they don't want to pass on to their patients. And under this government and under this Treasurer, further taxation, further cost that is going to put these small businesses at risk, Mr Deputy Speaker. We know that our hardworking staff across our frontline services in our hospitals, and in particular my local hospital at the Mackay-based hospital, are already under strain from the lack of support, the lack of resources by this government, and this government failing to listen to those at the front line. And have we ever heard, Mr Deputy Speaker, advocacy by those opposite? No, crickets, Mr Deputy Speaker. I'd like to know whether the Treasurer and how many government members have actually met with GPs and practice managers since the introduction, and how many of those are applauding this government, Mr Deputy Speaker. If you want to end the chaos and crisis of this Labor government, then I urge anyone who sees a GP and wants to make sure they can afford to see a GP, change the government, show Labor the door in 24.